28 years old female with history of opioid use disorder, IV, heroin, and PTSD presents with shortness of breath, chest pain, flank pain, and fever. And based on history presenting symptoms, the most likely diagnosis would be endocarditis, as research shows that infective endocarditis is highly predominant among opioid use disorder and IV drug users. The three possible differential diagnoses would include endocarditis, acute kidney injury, and pneumonia. Diagnosis, test, treatment, and referral would include obtaining TEE, blood tests with culture, CBC with differential trending, creatinine to rule out acute kidney injury. Treatment option would include a 4-week course of antimicrobial therapy. Referral to cardiology, nephrology, and pulmonology consult will be done due to possible cardiac, renal, and pulmonary involvement and associated risk factors related to IV drug users. Endocarditis pathophysiology. Endocarditis is an infection of the endocardium. It occurs when microorganisms from another part of the body, such as mouth or skin, spread through the bloodstream, attaches to the endocardium and invade the heart valves, causing inflammation and formation of vegetations on the inner lining of the heart. Etiology include presence of abnormal tissue in the heart, presence of microbes in the bloodstream, decreased host defense due to immunosuppressive diseases such as HIV, as well as those on corticosteroid therapy, IV drug users, surgical procedures such as heart surgery and dental surgery are all at risk of endocarditis. Signs and symptoms. Endocarditis may be subacute or acute depending on the causative of microorganism and whether or not there's any underlying heart issues. Symptoms include flu-like symptoms such as fever, chills, shortness of breath, chest pain, aching joints and muscles, EKG changes, swelling in legs, feet, and abdomen. Complications. Clumps of bacteria and cell fragments may break loose and migrate to other organs such as brain, lungs, abdominal organs, kidneys, or limbs, leading to a more severe complications such as kidney damage, pulmonary embolism, heart problems, as well as stroke. Treatment options will include antimicrobial drugs like vancomycin, amoxicillin, cefalexin for at least 4 weeks, as well as cardiac medications as needed. Prophylactic treatment for at least 1 hour before surgical procedure using a combination of penicillin, amoxicillin, clindamycin, and cefalexin. Surgery may be required. IV antibiotic therapy, including fluid and electrolyte, would all be part of treatment plan. Pneumonia, pathophysiology. Pneumonia may begin as an acute infection in the lungs and relate to a systemic in the lungs or related to systemic condition. The air sac may fill with fluid or purulent substances causing cough, fever, chills, shortness of breath. The causative microorganisms include bacteria, viruses, and fungi. Pneumonia is one of the most common causes of death in the US. It can be life-threatening and most commonly occurs in the elderly population with comorbidity as well as immunosuppressed patients. Acute kidney injury. Pathophysiology. Acute kidney injury is a sudden decrease in renal function with elevated BUN and creatinine. Opioid drug users are at more risk of multiple organ damages. Research study shows that heroin users is related to developing glomerulosclerosis, which is the scarring of or hardening of the glomeruli. Acute kidney injury and rhabdomyolysis has also been reported in heroin and opioid drug users. Acute kidney injury signs and symptoms include oliguria, fatigue, chest pain, shortness of breath, confusion, nausea, as well as seizure or coma in severe case. In conclusion, the original off-the-cuff differential diagnosis for these patients were endocarditis, acute kidney injury, and pneumonia. The diagnosis remains the same. The reason is as a result of the type of patient population that I care for. So as a site nurse practitioner, this type of patient population as presented in this case is similar to actual clinical situation. And so based on that, there was no, it was almost as a second nature, and there's really no difference from what I would have expected to be. Thank you.